Hi guys, just doing a quick check-in. Started the first day of my last cycle of chemo. So I had scheduled to do 4, and then be reevaluated and see what's next. If you've followed any of my videos, you know that I was diagnosed with colon cancer about 3 months ago. And I actually got on here to kind of demonstrate what happens to your voice when you have chemo, what happens to my voice. And chemo is such an interesting thing because I think it affects everyone so differently. I have not lost my hair, my skin and my nails and my hair and all that have been remarkably healthy. And but it's interesting when I do go in and actually have my first 2 infusions that I have at the hospital, I lose my ability to talk correctly. And fortunately it goes away after a while, but I kind of wanted to record it just because my voice sounds different. And enunciating is very, very hard. It's like you lose control over your ability to talk, something that is so natural. Like I said, fortunately, it does go away. My symptoms, my side effects of the chemo this time were not that bad. The usual nausea, sort of non-productive nausea, a little bit wobbly. The pre-meds definitely help. They help with the cramping and they help with the discomfort. But there's nothing that can help with the enunciation other than really, really focusing to try and say what needs to be said. It's very scary. It's temporary, but it's very scary. The peripheral neuropathy kicks in very, very fast. So have to have the perfect water temperature to wash your hands. Every time you reach into the fridge, even for something just slightly cool, for something that's slightly cool, you can feel it. Everything's cold. Sometimes you kind of lose, for me, I don't lose my ability to swallow, even though I'm having some aphasia, inability to enunciate properly. You do, coughing is different. Coughing is, you cough with your whole body. You take every nerve cell, every nerve signal from your brain to your coughing mechanism to cough, and you don't cough properly. You don't cough in your throat. You sort of cough with your chest, which is different. And you're not going to get much done for the rest of the day. I try to be really careful about swallowing anything, at least for the next few hours. I'm not going to be eating a salad, or I'm not going to be eating anyways, but even to drink, a glass of water, to swallow some pills, just be really, really careful. But everyone's different, and I think the most anxiety that I've had is going in for that first time, because I had no idea what to expect. And it was very, your meds aren't quite dialed in yet, and just stuff like that. And the first time I went into the infusion center, I had a woman next to me who was very chatty, which was totally fine. But she was also very upset, not with the chemo, she was upset with her homeowners association. And she was very vocal about how she wanted to draft this letter of sarcasm to respond in a perfectly immature way to her neighbors for whatever reason. Who knows? But, this lady was probably in her 60s. And I just remember thinking, God, this is very high school. Anyways, so that sort of ramped up the energy in the room because she got everyone involved, except for me, who was sitting there my first time and going into a panic attack because I didn't feel good and I felt sensitive and I just wanted her to shut up. Like, the chemo infusion room is not a place to air out your dirty laundry. Anyways, I didn't say anything about it, but of course the nurses and everything picked up when they had to put me on anti-anxiety to get me through my infusion. And the woman ended up apologizing to the nurses for the nurses to apologize to me for talking so loud. And so people sort of handle stuff differently. And, for me, my first infusion was a really, really big deal. For her, maybe it was several down the road. Maybe it wasn't that big of a deal for her. But, ever since then, it's been much different. But I also know now what to expect. And I also know that to speak up, to not let, if something's not making you happy, if something's too much for you, to let people know and to try not to be strong. This is what I was talking about yesterday, that being strong is kind of overrated. Obviously you want to react appropriately, but sometimes reacting appropriately is letting people know that you're not strong. And I think having chemo and having cancer and being in the situation reminds you of both your strength, how incredibly strong you are, and I think you come to realize that in retrospect, but also how vulnerable you are, and that on the days that aren't good, that you're vulnerable, and that there's no such thing as being strong all the time, and there's no reason to be strong all the time. There's no prize for it, Anyways, today's my first day of my last round of chemo. So I made it this far. I learned a lot along the way. In retrospect, which is sort of how I find clarity. In retrospect, my cancer is maybe not what it seems. I think that there were some assumptions that were made in the beginning, and that it's time to change course. And now that I've been doing this for a couple of months, now I have a voice, and I have the encouragement, and I have my experience behind me that I can go back to my oncologist, who I haven't seen for 2 months, and say, I need to have surgery. I can't have this quality of life doing endless chemo, waiting for the tumor to go down. Like, my quality of life is suffering now. And so I'm really grateful. And wow, I didn't expect to be. I cry every day now. I had never, this is ridiculous. Anyways, now I have a chance to say what needs to be said and to speak from a place of experience and knowledge and knowing and confidence that now I know what I want from this. Now I know what I want next. And I now know that I have so much support behind me in the nurses and the doctors. There's several doctors. You don't end up with one doctor, you end up with several. And I think that's in a good way, because you get such a diversity of opinion and personality, and while there's always a standard of care that's in place, that you still have very different doctors and very different nurses, and all of their years of experience is manifest in this moment with you in your treatment, and to be reminded of that. I'm really lucky that I'm actually in a small hospital. I had one doctor kind of suggest that maybe I move to a bigger city, or that I move to a place where I could be cared for, that I would have more access to more treatment options. And I think in some cases that's great for people. For me in particular, I now know that I had one doctor, and he wasn't even my doctor. I was admitted into the ER, and he became the hospitalist who, encouraged me to get a second opinion, and things maybe don't make sense. But your treatment's maybe not making sense anymore. Not that it's not working, but something's being missed. Anyways, one of the things that he said is that he knew my name, and he knew my name because the doctors here keep track of the cancer patients, whether they're their patients or not. They keep track of them so that they don't fall. So they don't fall in the cracks. And there's something really wonderful about being cared for when you don't know that you're being cared for, or when you're being watched out for but you don't know it. When people are rooting for you and you don't know it, you find out, like, wow, I don't even know this person, and they're keeping track of me and my health and my treatment and my outcome. I mean, how amazing is that? Sorry. I try not to cry. Maybe it's a medication. Maybe it's the chemo brain. Who knows? But anyways, don't ever forget. I can think of people out there who don't even know I exist, but somehow I got wind of their story or their situation, whether it's their personal life that was disclosed to me that maybe shouldn't have. And, obviously things don't go past me, but unless they have to do with myself. But there are people out there that I root for, and that I hope they do well, and they have no idea. I would never tell them. I just, some people you just connect with in an untold way, and you root for them, and maybe someday they'll find out. Who knows? But keep that in mind, that there are people that are rooting for you that you don't know about. And it could be the caseworker that you saw 2 months ago. It could be the person in the ER who's 20 years old, but maybe someone in their family is going through what you're going through, or went through what you're going through. Maybe there's just someone out there who just thinks you're a nice person, you're a good person. Maybe you did someone a favor sometime. It was nothing to you, but maybe you made someone feel a way. And because of that, if they find out you're sick, they want the best for you. It's very, very, very powerful. And don't forget it. All right. that's it. We'll see you guys next time. Hopefully I will be rolling into surgery for a successful removal of this stuff I have on my stomach. All right, bye.